Okay, let's talk about how a Dentis torque wrench is put together. As you can see, it is a two-piece device. There's a main body that has the swing bar that's attached to it, and there is an internal component. This internal component has a tooth, a sharp edge, and this is important. This portion has to go through the shaft and has to come through this ring, and it has to be visible. So a common mistake that assistants could make is to not assemble this properly. We tighten this fully, hand tighten, and then we pull this shaft back and forth, and it's spring loaded. The arrow should always face the long movable shaft. That is the default. We can intraoperatively change it for different purpose, but when the assistant hands this to the clinician, it always should be put on the right angle, arrow pointing towards the shaft. So this is the setup. The way to figure out whether it's correctly inserted is to look inside this ring and to be able to see whether there is this little projection, tiny little projection of the piece of the metal in that area. If it is if it is actually there, it's fine. Let me pull this, now it disappears. If I pull this shaft, the spring-loaded portion, it disappears. You need to be able to see that. And once you see it, when a driver, be it a screwdriver or implant mount driver, is inserted into that spot, it should be able to engage. Here I'm hearing the clicking noise as I'm turning it backwards. So the spring-loaded teeth portion is correctly engaged. The last thing you want is that not to be engaged and handed over in the middle of the surgery. So what can cause that to not engage? One, this portion may not be tightened all the way. If it's not tightened all the way, then that portion of the tooth may not be fully engaged. Number two, although it might be tightened, somebody may have carelessly stuck this outwards and turned, so it's not fully engaged. That's another common thing that happens. So always arrow towards the swing bar. The third reason is there could be gunk buildup. This, each and every use, should be disassembled, cleaned inside and all the components, and then reassembled immediately before use. If there's any gunk buildup and is repeatedly autoclaved, and the gunk will harden, and therefore when you try to engage, things may get stuck on the inside. So there's a quick summary of how we use the Dentis Torque wrench, and it is commonly used for screwdriver or implant mounting driver, and you can tell because I have this gear, the teeth that fit directly into this component.